But the truth is, conference, right now, the NHS is letting people down. Let me tell you about Claire, who messaged me on Instagram. She is a stage 4 cancer patient. When she felt pain 2 years ago, she struggled to get diagnosed. Her employer provides private health insurance, and for the first time in her life, Claire used it. Had she stayed with the NHS, Claire is certain she'd be dead. Instead, she's been able to live her life to the full, including getting married in Ibiza. Every cancer patient deserves world-class care. But for every person like Claire who was able to go private, there are thousands more who can't. That cruel lottery is the legacy of 14 years of Conservative neglect. That is the two-tier system of healthcare that Labour will end. And that is why we must reform our NHS. It starts with honesty. So I asked Lord Darcy, a cancer surgeon with 30 years' experience, to lead an independent investigation into our National Health Service. The results are grim. 100,000 toddlers and babies left waiting for 6 hours in A&E last year. Cancer, more likely to be a death sentence here than in other countries. Nearly 3 million people off work sick, waiting lists at record highs, patient satisfaction at a record low, and the fundamental promise of the NHS that it will be there for us when we need it has been broken. Broken by a decade of underinvestment, by a disastrous top-down reorganisation by the Tories, and by ditching the reforms made by the last Labour government. All of this meant that when the pandemic hit, our NHS was on its knees and hit harder than any other comparable healthcare system. It's not just that the Tories didn't fix the roof while the sun was shining. They doused the house in petrol, left the gas on, and COVID just lit the match. That's why millions are stuck on waiting lists. That's why ambulances don't arrive on time. That's why you can't see your GP. Never forgive, never forget, never let the Tories do it again. Look, I know the doctor's diagnosis can sometimes be hard to hear. But if you don't have an accurate diagnosis, you won't provide the correct prescription. And when you put protecting the reputation of the NHS above protecting patients, you're not helping the NHS, you're killing it with kindness. So I say respectfully, but unequivocally, I won't back down. The NHS is broken, but it's not beaten, and together we will turn it around. And make no mistake, the Tories had a plan for the NHS. Mismanaged decline. A status quo so poor, people are forced to raid their savings to go private. A crisis so bad that 7 in 10 people now expect charges for NHS care to be introduced. I've said it before, I'll say it again. Over my dead body, we will always defend our NHS as a public service, free at the point of use, so that whenever you fall ill, you never have to worry about the bill. The conference, we can only deliver recovery through reform. Without action on prevention, the NHS will be overwhelmed. Without reform to services, we'll end up putting in more cash for poorer results. That's the choice. Reform or die, and we choose reform. Since the general election, we've hit the ground running. We inherited the farce of newly qualified GPs facing unemployment. Patients can't get a GP appointment while GPs couldn't get a job. We cut red tape, found the funding, and we'll have 1,000 more GPs treating patients. That's the difference a Labour government makes. We're banning junk food ads targeted at children. The first step towards making our country's children the healthiest generation that has ever lived. That's the difference a Labour government makes. Strikes have crippled the NHS, cost taxpayers billions, and saw 1.5 million appointments cancelled. Do you know, my predecessor, her ministers, the previous Conservative Health Secretary, hadn't even bothered to meet the junior doctors since March. I called them on day one, met them in week one, and in just 3 weeks, we negotiated a deal to end the strikes. That's the difference a Labour government makes. Ending the junior doctors' strikes and building a new relationship with resident doctors was central to our commitment to deliver 40,000 more appointments a week. But as well as getting staff back to work, we need to get them working at the top of their game. We're sending crack teams of top clinicians to hospitals across the country to roll out reforms developed by surgeons to treat more patients and cut waiting lists. And I can announce today that the first 20 hospitals targeted by these teams will be in areas with the highest numbers of people off work sick, because our reforms are not only focused on delivering our health mission, but also moving the dial on our growth mission too. We will take the best of the NHS to the rest of the NHS, get sick Brits back to health and back to work. That's the difference a Labour government makes. But conference, we can't fix the crisis in our NHS without fixing the crisis in social care. And we can't fix social care without the people who work in it. I loved what Keir said yesterday about his sister, a care worker, about his determination to make sure that when she walks into a room and tells people what she does for a living, that she receives the same respect as the Prime Minister. So let me tell you, as the Secretary of State for Social Care, I won't let Keir down, his sister down, or fail more than 1 million care professionals just like her. Angela and I will deliver a new deal for care professionals, a fair pay agreement to improve pay and conditions and give staff the status and respect they deserve. Our first step towards building a national care service. Thank you. Thank you. Every day in this job, I see the scale of the challenge. But I also see something else, the potential of our NHS. The Tories' biggest betrayal wasn't that they left the NHS unable to care for us today, it's that they left it totally unprepared for tomorrow. Advances in genomics and data mean the healthcare of the future will be more predictive, more preventative, and more personalised than ever before. Detecting from birth a child's risk of disease so we can act to keep them well. Spotting cancer earlier, saving countless lives, treating patients with targeted medicines. To make these advances a reality for the many, not just the few, we need following things: a universal health service, free at the point of need, able to share data, partner with innovators, and adopt new technologies at scale. Such a service would be unique in the whole world. Conference, the good news is that service already exists. It's called the National Health Service. And our job is not just to get the NHS back on its feet, we must make it fit for the future. And that is what our 10-year plan for health will achieve. Conference, if we get this right, we will end two-tier healthcare in our country for good, so that the preventative care, precision medicine, personalised treatment are no longer just for the few, but are enjoyed by the many. That fairer future is possible, but only if we act today. An NHS running on fax machines can't seize these opportunities, but a reformed NHS can. From analogue to digital, from hospital to community, from sickness to prevention. Reform isn't just possible, it is happening. From AI detecting skin cancer and cutting waiting times, to weight loss jabs, slashing the risk of heart attacks for diabetes patients. But conference, to seize that potential, we have to reform the NHS to make it fairer. When the wealthy receive a diagnosis, they already know the best surgeons and can push to get the best care. But working people can't. If the wealthy are told to wait months for treatment, they can shop around. But working people can't. And if they pay top dollar, the wealthy can be treated with cutting-edge equipment and technology. But working people can't. Our 10-year plan will give all patients, rich and poor alike, the same information, the same choice, the same control. Now, I know there are some on the left who cringe at this, who view choice as somehow akin to marketisation. But our party has always believed that power should be in the hands of the many, not the few. That public services exist to serve the interests of the pupil, the passenger, the patient above all else. That world-class services shouldn't just be the preserve of the wealthy. So starting in the most disadvantaged areas, we will ensure patients' right to choose where they are treated, and we will build up local health services so it's a genuine choice. And where there's capacity in the private sector, patients should be able to choose to go there too, free at the point of use, paid for by the NHS, because working people deserve to be treated on time just as much as the wealthy. And conference, when we look around our country today, it's easy to be pessimistic. But the public have turned to us to give them hope. So here it is. We are in the foothills of a decade of national renewal, 10 years in which our country and our health and care services will change enormously. The NHS transformed into a neighbourhood health service, a digital health service powered by cutting-edge technology, a preventative health service that helps us stay healthy and out of hospital, and a new national care service ensuring people can live dignified and fulfilling lives. That's the change that lies before us. It will take time, and it won't be easy, We will have to fight loud opposition, cynicism, and vested interests. But conference, bring it on. It's up to us. It's up to us to prove that politics can be a force for good again. So let me say to every one of you in this hall and to the millions of dedicated staff in health and social care across our country, we are the generation that will take the NHS from the worst crisis in its history to build an NHS fit for the future. We are the generation that will build a national care service worthy of the name. The NHS there for us when we need it, with world-class care for the many, not just the few. That's the change Britain voted for. That's the change we'll deliver together. And conference, that change has already begun. Thank you.